right?
I can indeed, yes.
Oh, there he is. Now I'm okay. All right, well, let's just start the show. I'm going to introduce you, and this is our new ZOOMER, TV interview, and we're going to have one of my very favorite speakers and my favorite physician, because I want to ask you all about what's going on, of course, with the virus and your patients. That's really, I thought, would be a good topic for you. Okay?
Yes.
All right, well, we're going to start right now. So hello, everybody. I'm Anita Finley, and I have one of my favorite physicians on the new system that we're doing. We're now going to be doing the what we call ZOOMER TV. We're not going to actually be on the radio in a sense. So we're going to do it this way, and you'll be able to see it on Facebook, and you'll be able to see it on YouTube. And so there's Dr. Jaffer with his beautiful smiling face. And you know, Dr.
Right.
Jaffer, I don't know if you know, but I've been using your pearls, on a lot of things. I keep throwing them in. It's such a special thing. But I'm glad that you're on now, because what I want to know is if we can talk from a physician's view to all the people, not only your patients, but all the people who are so concerned, what should they be doing? Is this going to change? Why don't you just make believe I'm a patient and talk to me?
You see, we are in uncharted territory. When you look at the flu, which is it's endemic in most countries, especially in the cooler countries, from November up to March, April, we have the flu season, and it kills about 35,000 people in America, and it affects about 4 to 5 million people. So but the good thing is that we have a vaccine and we have treatment for flu, yet so many of us succumb. So when the COVID pandemic just started, and especially in China, we saw the mortality rate was 20 times as much as flu. And so it right away, we knew this is a very virulent virus, and it has got a potential to kill a lot of our fellow human beings. And we didn't have a vaccine, and we didn't have a treatment. So that's what's so frightening. And then it came over. Unfortunately, I wish we as a nation had listened to Bill Gates, who told us in 2015 that something like this can happen and we should be prepared. Unfortunately, we were not prepared. But that's okay. That's water under the bridge. But today, we are faced with a threat that is, you can't see it, you can't smell it, and yet once you get it, you could even die. So a lot of people are trying to make vaccines, a lot of people are trying to make treatments. We are testing so many drugs out there that were partially used on different viral illnesses to see if they work on this COVID virus also. So there is a lot of activity all around the world. So that is reassuring. But the bad news is that even if today we have a vaccine, it has to be tried and tested before you release it on the population. And then once we know it's a vaccine that works, how do you make billions of these vaccine copies to give to the people in the world? That's the other logistic problem that we will face. Or any treatment, if we find, once we have tested it and we found that the side effects are not as bad as the effects and can help people how to mass produce this drug. We're talking about billions of copies of these drugs. So that's the fear and the reality.
So before you continue, I got so excited about having you on. I never introduced you properly. Let me do that. This is Dr. Mohsin Jaffer, who is the founder, and actually he's the director of operation. I'm sorry, he's the founder. That's his son. I was looking at Mohsin Muhammad, but he is the founder of a wonderful, wonderful organization filled with great doctors, senior medical associates. I just had to say that. So, and you know, he's so filled with joy as a physician. I love to have him on. So he's going to be continuing to talk about this subject. He's probably the only doctor I really asked to do this because I trust you so much, Dr. Jaffer. So continue. I'm sorry, but I wanted people to know who you are.
Thank you. I appreciate it. And no, we have a lot of clinics, and we mainly take care of seniors, which is the most vulnerable and susceptible segment of our population. People 65 and above seem to succumb more to this virus than the younger people do. So it is very important that your seniors who are listening in to stay at home, avoid social contact, avoid going out, and keep that to minimum. I know hopefully from next week we'll open up. So a lot of people are saying that this is not good. We should all go back to the way it was. And there is politics behind it, but there is also people are fed up of staying at home. A lot of people are out of work. A lot of people have got bored and they are fighting with their spouses and dying to get out of the house. So there is a lot of social upheaval. Plus, a lot of people are not earning a living anymore, and that is very stressful. So it's true. The whole world, and especially us here in America, our lives are upended. There is no doubt about it. We are in a tremendously difficult time. So if I were to have a magic wand, what would be best thing to do is we all had a treatment and we'll go out and mingle with each other, no masks, no social distancing, and carry on lives as before and treat it like a virus, like a flu. But we can't do that. And until that time, what can we do? If next week Broward County opens up, I strongly recommend that you maintain that 6-foot separation. You wear a mask. And you don't have to wear an N95 mask. You know, an N95 mask it's very, very good in protecting viruses coming in, or if you are infected, giving it to others. But this is better in a medical facility where they are dealing with active COVID patients. But a regular mask where you can't blow out a candle if you blow while you're wearing a mask, that's good enough.
Okay.
And they are softer and they are more comfortable. So that is good enough. And what you want to behave is as if I have COVID, but I'm asymptomatic and I could give it to my fellow human beings, or you who look so healthy and who are serving me or helping me or coming across, you don't look sick, but you may be infected and you may give me your virus. That's why the mask is so useful in stopping me giving anybody my virus in case I'm infected, because you know there is a window, 3, 4, even up to 10 days where you may be infected and you don't even know you have the virus on you. Especially younger people might never have a symptom, or might have very mild symptoms after many days of being infected. And while they are infected, they have the ability to pass on the virus to their fellow human beings. That's why wearing that mask protects me from giving others a virus and protects me from getting somebody else's virus. And that basically, going to a restaurant, they say they'll have 25% capacity. If you do have to go to a restaurant, stay far away. But I still believe that if you are above 65 and if you have medical conditions and you're not that healthy, you should avoid going out and social interaction to bare minimum.
I agree with you. That's very true. And I was, as you were talking about this, I was thinking about the people who are, when they have this and they then have to be at home, what happens to them? I mean, if they call you because you're their doctor and they say, I think I have this, what happens? What do you do?
You know, we told our patients to stay home even before the governor told us to do that, because I felt this was from what happened in China and Italy and the United Kingdom. We realized that the sooner we sequestrate our seniors and avoid the social contact, we may be able to salvage them. And that's why very few of our patients, out of the thousands of patients we have, got the virus.
Oh, that's fabulous.
Yes, and only one has succumbed, others got it and recovered. So your doctor will be very glad to field a phone call from you for any symptoms or any problems you have. don't hesitate in calling your doctor and asking for an opinion. Please don't rush to an emergency room still, because that's where people with virus sicknesses go there. And therefore, you are more susceptible to go in with a cold and come back with COVID, you see, and you don't want that happening. That would be a catastrophe. So you want to avoid going to the emergency room unless it's a 911 type of emergency, you know, it's life and death situation. Otherwise, call your doctor. Most of the doctors answer you back, even if it's in the middle of the night, and get their opinion on what to do. And testing, you can get testing done in all of their count. There are so many places all over Broward County where you can go and get tested through a drive-through facility. But you don't need to test unless you have symptoms or you feel you may have got the virus. Because if you feel you got the virus, you may be asymptomatic, but you might give it to your loved ones or friends or family. So these are some of the precautions I would ask you to even do after next week's opening.
So let me ask you now and talk about symptoms. What are the symptoms? Oh, I'm back here. Oh, this is good. I'm now on. Oh, hello. This is better. All right. So here I am. So tell us what the symptoms are.
It's such a wide spectrum of symptoms, from not having any symptoms to a headache, mild headache, very strong headache, and you can have sore throat and then cough, and then the cough gets so bad. You see, basically the virus enters your body through your mouth or your nose or maybe through your eye. These are the entry points. And then once you get them, you may have a sore throat, and then your body might kill the virus. But if it doesn't, and they multiply so much, then they trickle down the throat and go into your lungs, which seems to be a predilection for this virus, and it affects your lungs. But some people even get diarrhea and upset stomach, see? But basically it's your lungs. And here is another irony, that a lot of people don't do well, not because of the virus, but their own body's reaction to the virus. They get this overwhelming response, this overwhelming immune response, saying, you are bad guys, we must kill you. But what the body does, secretes a lot of fluids, does a lot of inflammation, and it's like a storm that drowns the lungs, and people start dying because their lungs are filled with fluid, or they cannot breathe. And there's also another thing we have found, which is so frightening, is that this virus has the propensity of clotting your blood. So a lot of people didn't die because of bad lungs, but they died because of clots in their arteries, and they got a heart attack or a stroke. So this is the other thing we're discovering about this nasty virus, that not only it damages your lungs and you may dry them, but you may have a heart attack or a stroke or blood clots. You know, some people find out they've got the virus because they've got blue toes, because the clot has clogged their arteries, and now they're not getting blood in their toes and they are red to crimson. So this is the varied aspects of the virus. And there is another looming possibility that this virus may mutate like viruses do. Why we don't have a treatment for common cold? Because the virus mutates. Even for the flu vaccine, every year it's changed to the most likely new mutation that we can attack. And we make the virus vaccine for those possible the viri that may come and infect you as a virus, as a flu for a flu vaccine.
So Dr.
Mutation,
Jaffer, excuse me, but I'm hearing you, but I'm worried about you and your other doctors. So you said next week you're going to open. Who are you going to see? And,
we already opened from Monday. We already opened. So we have the personal protection equipment.
Okay.
And we're not drawing blood anymore in the office. We're saying you have to go to the laboratory, which is better equipped. And we only have one person in the waiting room at one time. So we're trying to do the social distancing, but some people need to be seen. Some people have a need, because they've been away for 2 months, you see, and we are used to seeing our patients every 3 months at least. But some of the seniors have got overwhelming need to be seen by a doctor. And those are the patients that we are saying, come in, we'll take care of you. But we will protect you, we'll make sure you're wearing a mask, we make sure you wash your hands before you come in. You sanitize your hands and you come in and you wear a mask. And our staff wash hands and sanitize after every patient. So it's very cumbersome and it's very slow. So we can't see many patients. It takes us about 45 minutes to an hour to just see one patient. But
well, I
that's
was
the price
thinking,
we pay.
right, but I was also thinking that there's one thing that your organization is so good at is really caring about the individual, and you know them so well. And so what I'm really wondering is, and I'm sure you're seeing now, the mental distress. I was just told, and I should have known this, that many of the senior communities, the people live in their room and the food is brought to them. They don't even get out into the social
True.
world. It must be
No.
very scary for them.
Yes. You see, the isolation for seniors is a big problem. And this leads to depression, and really people are feeling very distraught over this isolation. And we are gregarious animals. We like that social interaction. That's very important for our mind, body, and soul. But unfortunately, in this time, even grandchildren and the children don't visit the seniors because they might bring the virus to the granddaddy or grandma, and this might be her death sentence. So even family is not visiting seniors. Leave aside the other social friends and the circle around them. But what you are doing with this Zoom, this media has really helped a lot. People can go on YouTube, can then talk on FaceTime, they can talk on Zoom, and they can talk with family and friends all over the world. So that gives you a little bit of an input where you can see, like just now, I almost feel I'm sitting across you. You are about,
Same way, I've never seen you so close.
You're right, you're about 50 miles away, but I feel
Right,
we are just sitting across the table.
Right. And you used to be on the microphone. I was right there, but somehow you're full face now. And I love this. You have this beautiful smile. So this is fantastic.
Thank you. So this has shortened that distance for seniors.
Okay. So let's see. So I just dropped my phone where I had you on. That's going to be interesting. So I don't really have you now. That's okay. So let's just, let's go back to this about what are we going to do with now children who are getting this?
Oh, now the children, it's a whole, you see, up to now, we had felt that the children are spared. They are not doing as badly as the seniors are doing, but they are getting infected also. So this all bears to the fact that this virus is perhaps mutating in its lethality and its infectivity. So the young were spared up to now, and perhaps now they may become susceptible. But on the other hand, a lot of societies have kept the schools open and have asked the young to go to work while they've asked the seniors to stay home. So that's another way to look at it. I don't know how that's going to pan out because there is a resurgence of the virus in China and Korea and even in Sweden, which they had not closed down. So we are beginning to learn about best practices because we didn't know really what was the best practice. It was all a trial and error. And the world is slowly learning how to deal with this virus in different ways. And there is no right or wrong way, but definitely testing is important and isolation is important, and self-protection with a mask. These are three things we know definitely are very good.
So Dr. Jaffer, can you hear me now?
Yes, absolutely.
Oh, good. Okay, I just want to make sure. We're working through this, but okay, well, so that was a little scary. So now I agree with you. I actually I don't go even to Publix. I just have ordered directly and they're delivering to me, and and I'm doing everything I can from home. But my children, my grandchildren rather, that's another interesting aspect. They have been schooled at home, and it's all new. It's very interesting. Yes. I think what's going to happen, the positive parts, and I always like to look at positive. I believe that we're going to look at things that we took for granted, and now we're going to do a better job of living our lives once we get this under control. What do you think?
I think America has learned a lot. We learned a lot about e-commerce, about not being producing our own medicines, not our food supply. Also, a lot of it comes from abroad, and we're not self-sufficient. So we also learned a lot of things to become more self-sufficient. We had farmed out a lot of our medicine and food supply outside. So we learned a lot from there. Also, people have learned how to communicate despite the fact that they cannot meet and touch and talk with each other face to face. So that has been positive. And this e-learning with schools, it's great. I hope it's a level playing field, because if every child has access to the best education, it'll be a good idea that we have evolved to this level with modern technology at our beck and call.
Right, but I think the other thing too is that people, just like we're now doing Zoom, I think that a lot of people who are working at home may not want to go back to their offices because they can function at home, but also we haven't touched on telemedicine. Are you doing this?
Oh yes, we're doing telemedicine. So a lot of our patients can call in and talk to our doctors face to face. And telemedicine is a very useful tool. In fact, in our charity clinic, the UHI charity clinic, which we have in Miami Gardens, we have also specialists who will call in from all over the country to help our doctors for any problem they need to resolve. So that's been happening for a while. But telemedicine is, but you see, medicine is a touchy-feely science. You need to understand your patient, you need to examine the patient, you need to understand. And also when a physician or touches the patient, there is exchange of a lot of humoral factor. So this physical contact with your patient is very important. I feel that that should never be lost. We should maintain that when things get better. But in thus bad circumstances we are in now, telemedicine is a good substitute. Also, telemedicine has been started before the COVID pandemic by a lot of hospital systems, where you can call in for a small sum and talk to a doctor face to face, tell him or her your symptoms, and you get a real solution and a prescription is called in. But it's not for everything. It's for minor problems. Yes, I think telemedicine does fill the gap. Or to find out what to do next, so that you don't rush to the emergency room. You talk to a doctor and you find out, gee, doesn't sound more than a cold. Do this and you'll be okay. You don't need antibiotics, or you don't need this surgery or this drastic remedy. It's something very simple. And if it doesn't get better, call us back or then come into the office. So this way, telemedicine, I think, fits a very good gap.
Yes, well, let me tell everybody again, this wonderful guest is Dr. Mohsin Jaffer, who Dr. Jaffer is the founder of the Senior Medical Associates. We've been working with them for so long, and I have such great admiration for him and for the people whom all the doctors he hires. And of course, I don't want to forget his son, because his son is Mohammed is the person that runs the office, and he's so sweet. Do you have other children, by the way?
Yes, I have a daughter and a son, another son, the older son, who have helped me. My daughter is an architect. She helped design all our offices. And our design was meant to be very different from regular doctor's office. Seniors don't like to come into an isolated waiting room, to have a window that is covered, to have an open design where you see the staff, you interact with the staff, you talk with the staff. There is no separation. So seniors feel like they've come to visit their long lost daughter, and there is no barrier, and therefore better communication. And you know, in medicine, the success is only guaranteed if the patient and the doctor and the staff have a good harmonious communication. Because many times the doctor has diagnosed right, has given the right treatment, but patient doesn't get well. You know why? Because the patient didn't believe in the diagnosis or didn't believe in the treatment. and did not take the treatment.
That's
And
right.
that is compliance. And compliance only comes with a comfort level that the patient has with his or her own physician and the staff surrounding them. A pleasant feeling. You feel good. When a patient leaves the doctor's office, they should feel satisfied that their needs were met, all their symptoms and signs were addressed, and now they have a solution which they believe in that will make them better. And you know, the mind is so powerful. Now, 40 to 60% of all cures are here. Even if the prescription is wrong, but the patient believes I'm going to get well, they will get well. This is the beauty of psychology and placebo effect.
Yes,
So,
that's good that you say that. Well, no, so there is something else that I feel, and then in my capacity of my training with the seniors, that they really, if they're, almost everybody, if they're really coming for a very serious meeting, they should bring somebody. You know, they really should bring a family member or a friend so that someone else can hear at the same time, or they should bring a pencil and paper so that they know what they're talking about. And so what do you think?
this is a very good suggestion. I'm so glad you brought it up, because even for a normally functioning person, half what the doctor or somebody says may be lost, because when the doctor is talking, you have a thought on the last thing he or she said, and you didn't catch what he said next. And if you have somebody with you, they can capture that, and then you can corroborate. And if somebody's writing down, it's perfect. And with my seniors, you know, as you get older, your mental capacity goes down, your retention goes down, your comprehension goes down. So having somebody next to you is absolutely necessary. You made a key point that if you are a senior, never go alone to a doctor's office. Take somebody with you. That's a great suggestion.
Thank you. And that just about wraps us up. And you are our wonderful guinea pig. I just love that you were so sweet to work with us on this. We'll be better at our next interview, but I want everyone to go to seniormedicalassociates.net, and then you'll be able to see Dr. Jaffer in all his beauty, and on Facebook and on YouTube, probably this afternoon. And I always thank you. You are just such a gem for us. And you're the pearl. You know, you keep talking about the pearls, but you're the pearl. So thank you, Dr. Jaffer. And we'll